Senator Johnson, would you mind calling the roll?
Blackwell.
Here.
Boyd.
Here.
Barnett. Barrett. Blackwell. Blackman. Blunt. Hickman. Horn. McMahon. Parks. Polk. You have a quorum.
Thank you, Senator Johnson. Before us today, we have House Bill 1725, and actually we have Senate strike all version to this. It's a fairly thick bill, but only sections 1 through 4 really are new language. The rest of it is all language that it currently exists. But let me go through in section 1, lines 56 to 82, identify the coverage group that we're going to cover. Persons ages 19 to 64 making less than 100% of the FPL. People who are employed for at least 120 hours a month in a position in which health insurance is not paid for by the employer. Enrolled as a full-time student. Enrolled full-time in a workforce training program. Enrolled in at least 6 credit hours as a student and working at least 60 hours a month. A parent or a guardian that is a primary caregiver of a child under 6. A person who is physically, mentally, or intellectually unable to meet the requirements as documented by a medical professional, or the primary caregiver of disabled child, spouse, or parent, providing that the disabled person qualifies as disability under the Social Security Act. In lines 83 to 88, it's a person who voluntarily disenrolls from private insurance or employer-sponsored insurance will not be eligible for coverage for a period of 12 months. Lines 88 to 90, the coverage group shall not include non-United States citizens who are ineligible for Medicaid benefits. Lines 90 to 92, the division shall verify eligibility quarterly. Lines 97 to 102, the division shall make forms and application process as simple as possible. Lines 130 to 138, funding source for the state match is going to come from managed care companies. We're going to tax them at 3%. Lines 166, this is in section 22 now. Lines 166 to 172, it creates that assessment of 3% I mentioned earlier. Lines 175 to 179, any amount generated from the assessment that is in excess of the amount needed to cover the state matching funds shall be used to enhance provider reimbursements. In section 3 is our language that requires the fail-safe for work requirements. So in lines 190 to 207, all parts of this plan shall stand repealed on the date that any of the following happen. CMS rejects the work requirement and or the funding source assessment. CMS withdraws or terminates any waiver that CMS previously issued as required by this act, or if a court nullifies the work requirement and the funding source assessment. And that's basically an explanation of the bill. Any questions? Yes, sir. Senator.
Thank you, Mr. Chairman. I'm looking at section 3 that would repeal sections 1 and 2 and subsection 29, if any of those following occur. What's the need to have all of that repealed? If we've tried to get the work requirement, if we vote for this work requirement and we pass it, and then it's later repealed, why do we have to nullify the rest of the good parts of this bill to help provide coverage to people?
Because it's contingent upon the work requirements and the funding. And if the CMS denies any part of that, then all the aspects of the bill are dead.
Do we have figures on how many people out there just aren't trying to get jobs that would be trying to take advantage of this?
We anticipate there'd be about 80,000 people who may qualify for this. And from a reasonable expectation. We think we may get up about 40,000 of those may actually enroll. We're also going to be putting people or trying to encourage folks to get on the exchange who are not currently on the exchange, who fall within that 100 to 138% of the FPL.
Because I just don't think there's this mythical Mississippian out there that's not trying to get a job or not trying to work that would be saying, hey, I just want to get this healthcare coverage without trying to better my situation or my family's situation. So I'm just not sure why we have to go with a work requirement. Thank you, Mr. Chairman.
Senator Hickman.
Thank you, Mr. Chairman. Just another question along kind of those same lines. My question was, as Section 3 is worded, it's if any of these 5 things happen, this act is repealed. Does that leave an avenue for, say, A happens, CMS rejects the division, rejects the work requirement at that point? Does that leave open for something similar to what happened in Georgia to happen? And my thing is, I get that this whole plan is contingent on a work requirement. And while I cannot say I fully support it, I understand and appreciate what we're doing, but I would like to leave an avenue open where we could do something like, a suit or something to make sure that this goes in effect. But as it reads to me, the moment that CMS rejects the work requirement, everything is repealed.
That's correct.
Thank you.
Senator Horn.
Thank you, Mr. Chairman. And I want to go back to line 60 in the bill. We say that we're trying to get to the working poor, and we have some almost 300,000 people who are characterized as being the working poor without health insurance, some of whom are working 2 and 3 jobs. And if we're only doing 100% of the federal poverty level versus the House position of 138%, which would cover a lot more people who are in that working poor category, why wouldn't we do the 138% poverty level?
Because basically what you're doing is you're destroying the exchange. There's I think about 140,000 folks we estimate who are currently on the exchange, and the feds actually pay the deductibles, the co-insurance, and the premiums on a number of those plans. And actually, we want to keep more people on the exchange. The reimbursement is better. A lot of the argument for expansion has been to help the hospitals. Well, if you're going to take the people who are currently have commercial insurance and put them on Medicaid, you just killed your hospitals.
So are you saying that some of that 300,000 estimated that we hear aren't on the exchange or on the Medicaid program, that some of that 100 some odd thousand you mentioned are on the exchange?
Yes, sir. We got about 135 to 140,000 people who are currently on the exchange.
So what?
And ironically, the exchange, which is paid by the feds, has a work requirement, a very strict work requirement.
So what's, I know you can't speak for the House and don't speak for the House, but the House put the level at 138%. What is the rationale there? Do you know?
Well, they're basically going to be removing people who currently have insurance, commercial insurance, and putting them on Medicaid.
Okay, and as it relates to line 92, we have a quarterly reporting requirement of recertification requirement on a quarterly basis. What I hear is that with the Georgia plan, for example, and I'm not sure when their recertification is, but there's a lot of recertification that goes on, and folks just don't fool with it. And so as a result, they've only had 3,500 people to sign up for their program. When the anticipation in the first year was that it would be 25,000. I worry that the recertification is going to have a chilling effect on folks wanting to even participate with the program. So I'd like to be recognized for an amendment at the proper time.
Any other questions? Senator Blunt?
Thank you, Mr. Chairman. I think I heard you say that you anticipate roughly 80,000 people would be eligible under this amendment, and you would think about half of those 40,000 would participate?
Yes, sir.
And whether it's 80 or 40 or whatever the number ends up ultimately being, what's the federal match for this category of individual who's at less than 100% of federal poverty level?
Our FMAP won't change. Right now, it's feds pay about 77%. We pay 23%. That'll be the same.
So the federal government paying the entire match for an expansion population for 2 years and 90% of the match after 2 years, we were not qualifying for that under this amendment. We're just getting the traditional match that we've already got for the existing population and not the enhanced match that would come with expansion.
That's correct.
And the population that you mentioned that's currently on the exchange, are those people at greater than 138% of poverty or under 138, between 138 and 100?
Actually, the exchange could go up to 400%.
So, and you said there are about 140,000 people on the exchange.
Sorry.
You said there are about 140,000 people on the exchange?
That's the estimate I've got.
How many of those people are between 100 and 138?
How many people?
How many, if there are 140,000 people on the exchange in the state, and it goes up to the percentage that you just said, I assume many or maybe most of those people are in excess of 138%. Is that, am I right about that?
They may be. I don't have those figures.
I think, well, my concern is that for those people, even if they're working, that this product, they're not going to be eligible for it. Well, they're not going to be eligible at all under your amendment, right? They're going to have to rely on the exchange and the deductibles and all the rest of it, whatever the exchange requires, even if they're eligible, but we don't know how many people fall in that category.
Yes.
Okay. And you would not want, you would not want to have 2 free years of Medicaid expansion, and after that, a 90% match for a program that the state economist has said is a net economic benefit to the state. You would choose the lesser match to ensure fewer people at a reduced economic impact under the amendment.
Under this, that'd be correct. That's your assessment.
Okay. Thank you, Mr. Chairman.
Any other questions? Senator Horn, you're recognized for an amendment.
So is it your understanding that in the first 4 years or so of this program, it wouldn't cost the state of Mississippi much of anything to participate in the program?
With the our estimates of the population and the tax, the managed care tax, we actually will have a surplus. So that's why we're saying that we want the extra surplus to go back into Medicaid to enhance reimbursement to providers.
Okay. All right. Thank you, Mr. Chairman. I'd like to be recognized for actually 2 amendments.
Excuse me, Senator Boyd has a question.
Senator Blackwell, I think something may have gotten confused in translation. From the Department of Insurance, isn't it correct that we have received figures that on the exchange between 100 and 138% is the 140,000 Mississippians? Yeah. Yeah. So I think there was something kind of lost in that translation there. So there's 140,000 Mississippians on the exchange between the 100 and the 138%.
I don't know how many are over the 138. Senator Horn, you're recognized for your amendment.
Thank you, Mr. Chairman. I'd like to be recognized to offer an amendment on lines 91 and 92 that the bill currently calls for quarterly recertifications or verifications of eligibility. And I'd like to strike on line 92 on a quarterly basis and insert in lieu thereof twice a year. And I'd like to be recognized to explain my amendment. I think it's self-explanatory, but.
You're recognized, Senator.
So I just think that a verification of eligibility should not happen as quickly as what this bill calls for, which is quarterly, that we can get the same benefit and the same result essentially of a twice a year verification of eligibility than one at 4 times. I think it'll be a lot less onerous to the folks we're trying to help. And I think the program will be a lot more successful as a result of that. I'd be happy to answer any questions that anyone might have.
Are there any questions of Senator Horn's amendment? I would, I understand where you're coming from, Senator. I think to keep with the consistency of the bill that I would just like to, I'd vote no against your amendment. And anyway, you have any other closing comments?
No, sir. I think our positions are both clear. I'll call for the vote.
You've heard Senator Horn's amendment. All in favor?
Aye.
Opposed? No. The noes appear to have it. The noes
Division.
have it.
Division.
Division. Can we have a raise your hand if you're for the amendment? Raise your hand if you're against. It was 6-4, the amendment fails. Any other questions? All right, all in favor?
Second amendment.
Okay, sorry, go ahead.
All right, on line 94, it was beginning on line 93 and on effectively on line 94. I'd like to change the average work requirement hours per week, per month rather, from 120 hours per month to 20 hours per week. All right, I'll be happy to explain this if I need to, Mr. Chairman.
Again, I would vote against your amendment. A number of states have about at 20 hours, and we felt to be a little bit more conservative, we wanted to go with the 30. So results in the 120. So.
Well, I think, Mr. Chairman, the effective, if we're trying to go after the working poor, excuse me, we're trying to go after the working poor, we're going to, I think, be, again, a lot fairer by lowering the work requirement to 20 hours a week rather than 30 hours a week, which is what's in the bill. That it again would be a little bit more egalitarian and accessible to the working poor.
I understand your amendment, but again, I'd vote against it.
Call for the vote.
So, all in favor of, does everybody understand Senator Horn's amendment? Oh. All in favor of Senator Horn's amendment, say aye.
Aye.
Opposed? No. The noes have it.
Division.
Division's been called. Those who are in favor of Senator Horn's amendment, please raise your hand. Opposed? 6-4 again. We're on the final passage of the bill. All in favor? All right, Senator.
Thank you, Mr. Chairman. It's back on section 3, and it kind of goes to what Senator Hickman was talking about. It seems we're providing too many ways for this to be taken, clawed back, because A, B, and C, that's on CMS. So say CMS approves it. Now, D and E put it on the court of competent jurisdiction, and we all know that can take 2, 3, however many years. And these people have now been on it for 2 or 3 years, and then under subsection 2 of they now have 30 days. So after 2 years of being on this, hey, 30 days, now you're done, you're back to where you were before. So I'm just not sure why D and E have to be in there if it's already got A, B, and C for why it would come back. Is there a reason that we have to have D and E?
You're talking lines 203,
And then on
206.
yeah.
Yeah, we just wanted to make sure we covered all our bases.
But are they not covered by CMS? I mean, if they reject it, then it's gone. If they've accepted it now, we're good to go.
There may be other groups or individuals outside CMS that may try to sue us, so that's why the language is there.
Thank you, Mr. Chairman.
I recognize Senator Boyd for a motion.
Title sufficient, D pass, committee strike all.
Heard the motion, all in favor? Say aye. Aye. Opposed? One no. The ayes have it, the bill will be reported. Senator. Oh, sorry. Now final passage of the bill. Senator Boyd, I'll recognize you for a motion.
Title sufficient, D pass.
Title sufficient, do pass. All in favor? Aye.
Aye.
Opposed? The ayes have it, that will be reported. Senator Boyd.
Rise and report.
Rise and report. Thank you.